Professor Rebecca Guy is an epidemiologist. Since the emergence of COVID-19, she says more people now understand her job title. Her research covers not just COVID, but a range of infectious diseases such as HIV and other sexually transmitted infections or STIs.
The common element has been about testing. So for all those diseases, the research has focused on ways to bring testing to the people.
And in particular to people in vulnerable communities. Rates of STIs are much higher in adolescents and young Aboriginal and Torres Strait Islander people living in remote townships than in non-Indigenous populations. A key reason has been the lack of timely testing and subsequent treatment.
If you have a sample taken, it's thousands of kilometres to the laboratory where the test is going to be done, so it's weeks before you get the result in many places.
By that time, the young person may have moved on without getting their result. Regular testing means early treatment, including cures for many STIs. It also reduces the chances of women being hospitalised for pelvic inflammatory disease and infertility. And in the case of HIV, treatments are life-saving, but rely on people being tested early.
Even in Australia, about 1 in 5 people diagnosed with HIV are diagnosed so late, their immune function has deteriorated to a point where they have AIDS.
Professor Guy's research has helped pave the way for the rollout of new technologies, including HIV self-tests that people can use at home before getting a result in 15 minutes. And sophisticated PCR testing at remote community-based clinics delivering results for STIs in 90 minutes. In that case, the local health practitioners were first in the world to use such point-of-care technology. Those same PCR machines have also been used for COVID-19 testing during the pandemic. Professor Guy says COVID has shown how quickly new testing technologies can be approved, funded and rolled out, including ones people can use at home.
Having a test, even if it's less accurate, is better than no test at all.
She hopes that same momentum can be used to improve access to testing technologies across a range of infectious diseases, and particularly for the most vulnerable members of society.